let's talk about it.
Hello and welcome back to Thicc Radio, the award-winning podcast where we talk about gaining, fetishism, and everything in their orbit. I'm James.
And I'm Tim, so let's get into it. Today we've got a guest on the show that we're very excited to speak to. Today we've got Andy.
Hello. How are you doing?
Good, how are you?
Good, thanks.
Good. We're so glad to have you on. We were really looking forward to recording because, you're one of those lovely guests who our connection began when you reached out to us to sort of chit-chat about an episode that we'd done. I can't quite remember what the episode was, or actually, was it Paging Dr. Gaynor? Was that the episode that you emailed in about?
I believe so, yeah. It was definitely a good bit of medical chat, and Ozempic was mentioned.
Ah, yes, it was the famous Tim Ozempic grant. Because you yourself are a medical professional, is that correct?
That's right, yeah.
Fabulous. So listen, today we're continuing on a series of conversations that hopefully will continue throughout the podcast's lifespan, addressing really the conversation of health, gaining, and fatness. So listen, Andy, are you ready to get stuck into it today?
Yeah, let's get started.
Fabulous. Well, listen, first cab off the rank. As we discussed, you are a medical professional, and in fact, you are a doctor. How long have you been a practicing doctor for?
Just gone 6 years to more or less the day that this is the usual week that new doctors would start. So it's been a while, not too long in the grand scheme of things, but yeah, long enough.
And what is your area of expertise?
Well, general practice.
Gotcha.
I'm still specializing, but that's my area now, through hospital medicine into general practice.
Gotcha.
Okay. And what inspired you to begin that journey to become a doctor in the first place?
I think a couple of things. And I think that the main thing was just being interested in science, being interested in biology, and just that those kind of subjects came naturally to me and seemed to click, and did well at them in school. And the other would be the kind of society as well. I've had good experiences with my own GP, family doctor, and probably seen them on TV as well, like ER and Grey's Anatomy and things like that. And then it just seemed like a good choice at the time to go on to college, university. Seemed like a good choice, really. Seemed like a good fit.
And God bless you for getting through medical school. Nursing school is hard enough. I didn't think I was going to get through nursing school. And then I was like, oh shit, a doctor's got to do 3 times this.
Yeah, well, a challenge to be sure. And there's definitely doubts along the way, but to stick with it as well.
It's always interesting to me, that conversation around health or the pursuit of a career in health versus gaining, because, Tim, we've talked about this any number of times, really. There's that constant back and forth that people must have. There's assumptions from society, there's medical bias, there's all sorts of narratives. So listen, to unpack that a little bit more, can you tell us about your gaining journey and how did those two begin to intersect? Did you have gaining desires before you'd settled on medicine, or was it after, and how has that all come together for you?
Oh yeah, it was definitely there before. Yeah, if I was unsure of making that decision at the time, I definitely wasn't unsure, just hesitant, I suppose, or a bit reluctant to pursue gaining. How they intersect is a challenge, I suppose, because you're still studying full time, but then you're also, for me, working in clinical areas meant that I was being a lot more active and under more stress and eating less, and had actually lost a bit of weight in that time as I was studying. And then it took a bit of time to sort of get more comfortable with the idea of gaining and being in this profession. It took a bit of time, and then I just thought, look, it's time enough. This is something that I want to do, and to pursue that in tandem.
That's good to hear. And it makes me curious. So obviously, as Tim was outlining, when you study to become a doctor, it's a great many years of study. You've been a doctor officially for 6 years. How long would you say you've officially dedicated yourself to the gains?
That I would say less than 5 years. It was shortly before COVID that I thought I was in a good position to do it. I was financially secure, like, working and had money, not on a student budget, and just living in, I suppose, sharing with others, but living in kind of separate accommodation, not with parents and family members. So you had that kind of personal space is what I'm going for there, really.
That makes a lot of sense. I think it's interesting to consider. This is a conversation piece that comes up a little bit more. I think so often with gaining, we come back to this point of, well, it's about how committed you are, right? As if to suggest that what we see output is equal to what is input. That's different for every person. But I think it's really important to focus on those elements, that it's not just what you consume and how often you consume, it's surrounding elements as well. Your ability to receive an income, your living situation and comfort. A lot of these different factors can actually cause a lot of hindrance to the gaining journey, let alone your willingness or your capacity, shall we say. I mean, Tim, referencing some of your commentary in the past about being a nurse and gaining, I mean, did you find that things became easier for you, like, as you became more of an established nurse?
I don't think that things necessarily became easier. It's just that, like, with the years going on and getting raises, I had more income to indulge. Because when I started nursing, I was actually making pretty bad money. According to everyone else that I was talking to, they're like, "Oh my God, you're making such shit money." I was working for a nursing home, and they historically pay terribly. But as the years went on, and I moved to different facilities, different places, went to hospital, went to private care, all this stuff. I was building up a pretty good resume, a lot of experience with different things, and that equaled more pay. So that became easier. But I don't think the fact that I'm a nurse ever had anything to do with me being a gainer. They are really very separate. I do think it's really interesting, though, that so many people in the medical field are overweight. You would think that it would be the other way around, but it really isn't. Like, and I can remember being younger, going to doctor's visits, and a couple of times I wound up in the hospital. A lot of overweight doctors, a lot of overweight nurses. Most of my coworkers are overweight. And people will sometimes ask me that question when they find out that I'm a nurse. They're like, "Oh, does this somehow, like, how can you be a medical professional and be intentionally unhealthy?" And I'm like, "Well, that's where you're making the mistake, because not all overweight people are unhealthy."
Something I think that's like I'd like to ask this. As much as you've made that decision 5 years ago to really put yourself into the gains, and for anyone looking at the social, of this gorgeous gentleman, you've been very successful on that front, dare I say. In that time since then, have you ever had any moments of, oh, not too certain, or feeling like there's maybe something for you to dig through or process in conjunction with all this?
Certainly, yeah. As Tim was saying, like, there are others out there of like varying sizes and looking after their health, but that isn't outwardly seen. And that worry or that anxiety in the social setting in work is you're always going to be around other people. And then that's definitely an internal thing of like, okay, is someone looking at you this way and thinking, oh, this doctor must be unhealthy because of his weight? And that anxiety can sort of knock around a little while and take a bit of time to process it and deal with it. There's always reminders, things that you might notice, like outfits and uniforms, or like chairs with arms. There's reminders there that are checkpoints, if you will, to really get you thinking, oh, what am I doing here?
We've talked a little in the past about, the experience of being a larger person in the workplace and how that can cause us to feel any number of different anxieties. I recall specifically even the conversation around lunch, the idea of food, and something that a lot of fat people talk about is how you're existing in the world, you're going to eat your lunch, and it doesn't matter what you're eating. People have a tendency to watch you while you eat. If you're eating healthy food, it's, oh, are they on a diet? Or have they had a sort of come to Jesus moment about the kind of food they eat? If it's junk food, it's like, oh, look at them eating that junk food. And then if it's sort of like whatever food in between doesn't really fit into any category, it becomes this incredulity of like, are they just eating so much? Like, maybe they should have a smaller portion. It's interesting how just existing as fat around other people creates narratives that we can develop anxiety around. Much like you say, you're in an office, it's a chair with arms, and all of a sudden your entire physical person, physical being is called into question because of a piece of office equipment.
I was just going to say, I've developed a reputation at work when it comes to like, because I work for 12 hours, 7 p.m. to 7 a.m. So right around midnight is usually when I go get my dinner, and they're like, "Oh, what fast food are you getting today?" Because it'll be Wendy's or McDonald's or Taco Bell, or I go to a gas station not too far away from work called Sheets, where you can get like fast food as well. So I'll go up there and I'll just go to town. I'll get like a burger and snack wraps and fries and a milkshake and like 3 bottles of soda and come back with this huge bag.
I mean, if I could ask for yourself, Andy, like when it comes to maybe more of the innocuous moments of the workday, let's say arriving at work, leaving work, there's instances of like getting out of the car and maybe other cars are parked very close, or it's walking down the hall, or just anything really. Do you feel like there are moments where you catch people looking or observing you and you have that moment of, is this about the fatness?
I think so. Sometimes it can be hard to distinguish that kind of anxiety because you're being more vigilant of it, or if that's actually happening. Like getting the bus to work or being in like a crowded environment and someone squeezing past you, like in a queue or something like that. I'd say probably happens more that I'm thinking about it more than the other person has thought about it. So yeah, that definitely does happen, but I can't say I've had any negative experiences of it. I haven't had any blatant, outright negative experiences of it.
I was once called out by a cleaning lady for putting on weight because I had been working at this facility for a good 6 months, and this is I think last year maybe or the year before, and I had been trying to push myself with my gains, and I look in the mirror and I don't see anything, but apparently other people did because I was just minding my own business at my med cart, and the cleaning lady comes by. She's like, "Have you put on weight?" And like in my mind, I'm like, "Fuck yeah!" But I didn't. I don't know. I kind of felt like in that dance, like that social dance you have to do with people, you have to like deny it, and you have to still be like, "Oh no!" And I just sort of looked at her and I went, "Thanks," and I went back to working.
In my last full-time role, a guy called me hench. He said, "Oh mate, you're looking hench," and I was like, "What?" I'd never heard this term before. It's a British term. Yeah, like it means henchman. Like I look burly, so I was like, "All right."
I do have a little anecdote that Tim reminded me of there. I called a patient on the phone that I met in person and, introduced myself. I was like, "Oh, you're the big lad, right?" And I was like, "Yeah, yeah, I'm the big lad." As the identifying feature that stood out to him was being big. So that, on the phone, I kind of taken aback, but I was like, "Yeah, that's me."
There's definitely worse ways to acknowledge size, I suppose. And I mean, Tim obviously expressed a sense of, sort of internalized fuck yeah, the positive element of it. Did you feel any of that in that moment, or was it all just kind of like a
I think that came afterwards, the acknowledgement of it. At first, it was kind of the shock and that sort of passed, or maybe more so just kind of like hanging up the phone and then just thinking, "Oh yeah, you call me the big lad." So yeah, that was kind of a nice feeling, I suppose.
I don't know. I'm curious about these experiences people have because I think we only have, in many ways, the fat lib approach to life to reference in terms of moments that occur and how they tend to make us feel. And obviously, when it comes to gaining, it's different because different people like different things. Some people really live for those moments, some people don't. I want to refer back to something you'd said about how, in a way, you consider that maybe you think about people thinking about you and your size more so than probably they actually do think about you and your size. And I wonder how many of us experience that. This comes back to something we talk about a lot in terms of people are afraid of people finding out because people seem to believe that everyone is obsessed with knowing their sexuality, or people are obsessed with knowing why they became so fat, as if our parents give a shit, or as if people in our lives have the spare capacity or mental space to really think about those things. So I wonder how much that happens for other people, where we consider the optics of other people more than we consider what might actually be happening. You know what I mean? So if anyone's got any data out there, that'd be really fascinating reading. But I want to ask you here, as a medical professional, because health often ends up being that conversation point that comes back to with regards to fatness, how do you navigate your own health as you gain?
I would say with some difficulty. And I think that's access in general to the healthcare that you need at the right time in the right place. We tend to move around a lot, might not have one kind of like established base and having the same kind of care providers and things like that. And also the time and the energy to go and maybe address certain issues that you might have. It could be easier to take some time off for, a day or two and go back and you're still not fully recovered if you have a cold or whatever else. I do like to try and balance exercise and eating healthily occasionally, and also taking that time to make that doctor's appointment and explain to your coworkers and managers and say, I need to take this time off to address my health. Because I think that not just for gainers, but for doctors and all healthcare staff, I think there's that sense of obligation that you always need to turn up and you can't miss a shift because someone else will bear the burden of you being missing and take on your workload and stuff.
I mean, Tim, what about you? I know we've talked about this in terms of that medical expectation. I know you've mentioned this, I know that April's mentioned this, that thing of in healthcare, people often put pressure on you to say, you're the person whose job it is to make sure that everyone else is healthy. How do you advocate for yourself when you need time to heal?
I mean, I haven't really had to advocate for myself too much because I haven't really had a lot go on. Like, I've been dealing with two medical problems that I had long before I was a gainer. I've had high blood pressure and sleep apnea, and I had both when I was a teenager. So I had those two things going in, but I manage them both. I have a CPAP and I'm on a couple of pills for my blood pressure. I I'm kind of a bad example because a lot of what I've been trying to do as a gainer to put on weight has been like not great food. It's been, a lot of things that are fried, a lot of things that are greasy, a lot of things that are very carbohydrate heavy. I do have to look out for my triglycerides. They are high, and I'm trying to deal with that. The biggest problem I keep running into is I can't swallow fish oil pills because they're gigantic. That's like the number one over-the-counter thing that's prescribed for cholesterol and triglycerides. But I'm working on it. Yeah, I don't know if I'm the best person to ask about that.
Well, if I can speak to my own medical thing for a moment, then, it's something I've been considering for a long time is talking to a doctor about the fact that I struggle to gain weight. It's one of those rhetoric pieces that growing up, I look at my family, everyone is rail thin. And so when people talk about the genetic factor in weight gain, I've always just kind of accepted carte blanche that, well, it must be genetics that really holds me up. And I don't know, something this year just made me go, fuck that noise. I'm not just going to accept that. Like, I'd like to go and talk to someone about this, please. And so I had a scheduled phone call with a doctor where I said, listen, I'm trying to put on some mass. I think that's going to make me feel really good about myself, but I'm really struggling to achieve this. I'm eating, more calories than I need to. But a friend had mentioned to me about potentially it could be a low testosterone thing or any number of little medical factors that could be really hindering that process. And is it possible that I can get tested to figure out what could be the cause of this? And the doctor said, yes, we can absolutely do that. So I know that it might take them a week to find me a slot to do some blood tests and a bit like that, but that's coming down the pipeline. And I'm really glad that I was honest and asked for it. We often talk about this as well with healthcare. The conversation around weight gain and telling your doctors, maybe you don't need to tell them that you're gaining fat specifically, but like having a frank conversation with people and saying, listen, I'm trying to change my body. I'm trying to do some things. Can you think of anything that might help me? And it's quite interesting how much help there is potentially available when you open yourself up and advocate for yourself,
I think that's a difficult thing to do. It's not something I've done myself. Interestingly enough, I did go see a specialist today about sleep apnea. obviously the weight was mentioned, but it was presented well, and that, you know, it was a factor. It wasn't just a, oh, dismissive, you need to lose weight kind of thing. It was losing weight is likely to help in that problem. And yeah, I didn't feel like I was in a position to be open about my reason for my current weight. I think it's challenging as well to balance that, you know, kind of eating your five a day, and also it's quick and convenient, like fried foods and lots of it delivered to your door. That works. That can get results for people. So yeah, it is hard to balance that out as well with being health conscious and eating your fruit and veg and getting exercise as well.
Oftentimes, when we talk about health, I don't know, I think it comes down to this argument of correlation versus causation, right? Like, does one thing cause another thing, or is it just assumed to be connected, yada, yada, yada? And that always comes, like, it's the sticking point, you know what I mean? I want to ask you here, as a medical professional and as gainers, what do we need to be aware of and what do we need to consider when it comes to any of those types of discussions with other people?
I think it is not maybe even consider like the discussion and how it's brought up, because I think that example, the doctor that I saw today, was quite clear that it wasn't just weight related, whereas someone else could be quite like dismissive or ask about it or comment on it in a certain way that isn't maybe very considerate, or that isn't open to that conversation about weight and associated issues that may or may not bring with it. And I know I've had some conversations where I'd sooner just bite my tongue and not get into it, because I feel like they're not going to be receptive to a kind of a conversation around that. And also because it might take that admission from myself of like, you know, actually I want to gain weight, and I'm also conscious of that these things can be associated with it. I could face these problems with it. But the other person on that end of the conversation is just automatically like, if you keep doing this, X is going to happen. You're going to get diabetes. You're going to have heart problems, that kind of thing.
Something that I think is always really important whenever it comes to this conversation is, you can be told something like fat leads to diabetes, fat leads to this, that, and the other. Now, doctors are scientists, so there is a scientific process by how they come to their conclusions, right? They have to perform studies and clinical trials and things like that all have to be performed in order for them to extrapolate data and publish it to come up with their conclusions. And this might require some research on your end, but I say look that up. Look up those studies. Find out where those studies came from. Did they come from a well-respected and well-accredited institution? How many people were used in the clinical trial? How many, what kind of backgrounds did they come from? Like, all this information has to be published. So just look it up. Find out what they came up with and how they got to that conclusion, because not all medical research is that thorough. Sometimes they get really sloppy with it. Like the guy who did the study about immunizations and autism had to retract pretty much everything that he said because it wasn't based on great research. But because the public got a hold of that and ran with it, we had a whole generation of kids that didn't get vaccinated. So that's why it's important to look this stuff up.
Something I find really interesting is how, in a number of different articles, if you look at a lot of the source reference points of, well, a certain journal or a certain article or a certain someone referenced the idea that, fat is proven to do this, X, Y, Z. And when you look at the verbiage, it's very interesting because a lot of this root frames it as, oh, it is commonly believed that this is what this is, or that this leads to that. And I think that's a very important trope that people need to be mindful of. It is commonly believed that fat will cause this, or that fat leads to this. That doesn't mean proof. That doesn't mean evidence. That's just acknowledging that in lieu of proof, the majority of people believe this to be true. And not so long ago, the majority of people believed that the Earth was flat. Those numbers have been rising, which is terrible.
Yeah, which is really scary, isn't it? That has come. That's back in conversation again.
Yeah. Yeah, let's revisit that along with women's rights, queer liberation, and everything about everything. Yeah, no, I thought the whole point of progress was to like come to a realization and put it down for a bit, leave it alone, put it in the
I
back.
just want somebody to explain to me if we're flat, what's under us? What's under us? What's holding us up?
Well, 17-year-olds would say "yo mama," but I don't know that that's true. At least not now. At least not now. Um, but no, the reason I bring that up is just because it is interesting to consider the not to say the faith we put in medicine when we it's not that. It's that we have this thought as non-medical people. I'll speak here as a non-medical person. The thought is, because this was me growing up, you go to the doctor when you need to go to the doctor, and when the doctor tells you this is it. Because why would the doctor be wrong? That's their job to know. It creates this sense of infallibility, which as we explore this, we should be realizing here that this is not the fucking case. People are people, people make mistakes, people also don't know all of the things, and also, like, I
And
don't know,
doctors can be bought. Doctors can be bought.
what doctors can afford.
It is not impossible for a doctor to get a huge paycheck from a corporation that says, we want you to go on camera and say that dairy is good for you. We want you to go on camera and say that coffee is good for you. We want you to go on camera and say that sugar is bad for you.
Mm,
They'll do it. I mean, if you're being offered $5 million just to go on camera for 10 minutes and talk, why the hell wouldn't you?
yeah. But also to the point, I think, and Andy, I'd love to know how you feel about this. My thought is if we have more rhetoric that shows that doctors are not infallible, that maybe this takes some of that pressure away from doctors, and maybe it takes pressure off of medical professionals. Yes, this is your job to do your best and to help and to be the best that you can be, because why wouldn't you try to be the best that you can be? But maybe there's something there where we need to stop shouldering the burden of health responsibility onto. Am I making sense with this? I feel like just as individual people, we ourselves need to have more generalized knowledge of health. That I
I
think.
think what you're highlighting is, again, that history of, there was a time when we have to kind of go back to a sort of past that didn't really exist, right? We have to kind of go back to the Norman Rockwell painting. We have to go back to that time when like authority figures were above reproach. A cop wouldn't lie to you. A doctor wouldn't lie to you. A priest wouldn't lie to you. And that has been baked into, at least in American society. I'm not, I can't say that for the UK, but in American society has been baked in for decades. Like because I can remember my parents telling me things like, cops are your friend, doctors are good for you, and they will tell you that what is best for you. Priests are people that you can trust, like, and we have been finding out as the decades roll on that is not true.
And I think the term we've used is paternalism in medicine, and how, it was a boys' club from the inception, I suppose, of like medicine and what being a doctor is. And it is shifting more to that patient-centered idea and that sort of shared decision making. But there's still always that need for like professional opinion that's being put forward. It's not infallible. It certainly is fallible. It may not be the right thing, but based on how things present at that time, but it's still clear advice based on that research. And we know that, yes, these things can be associated, you have a stuffy nose, that's usually associated with a cold, a virus, or hay fever. And the patient having that kind of knowledge or informed decision making then as well, that they can make decisions about their own health. And I think that's also important for everyone, but for gainers as well, that is put to them in an appropriate manner, not just a generalized way of your weight is the one and only problem, and that's the direct cause of this. It might be associated, it might be a factor, but yeah, it needs to be put that way. And it isn't always done that way in medicine with different, because everyone is different, as you said, we're human and fallible as well. So
I think something that would be good to bring up here is just ethics in general, right? Because I think we talked about this a little bit, like you looking after your own health, that professional opinion and whatnot. What is that intersection like in terms of, you are a gainer, you are a larger person, but then there's this point around ethics, around what is ethically correct for you to do or to present as or to demonstrate. What is that narrative like for you? And how do you navigate it?
I think at times there is that presenting that as a plan that someone might benefit from losing weight, for example. And the irony is not lost on me because it's like do as I say, not as I do in at times with advice I'm giving out about avoiding saturated fats for cholesterol and or something like that. And I think there is that responsibility that's in our guidelines to say we should take care of our own health. And that's something I've mulled over a lot. And I think it's still individual. I do take that into consideration as I'm gaining as well to kind of think, okay, is my health still up to like a standard that it's not causing patient harm or, is it impacting how I might practice, I suppose. It's going to have some impact, but I think I suppose acknowledging it and maybe I suppose being open to that kind of contradiction as well, but also that I'm looking after my own health at the same time.
Tim, how does that sit with you, that conversation point on ethics? Like, do you find that you're having to navigate those types of tropes, even incidentally, in your day to day?
I mean, honestly, the only time that that really comes up for me in my current field, like where I am, is like, again, I'm in a nursing home, and like when it comes to ethical practices there, it's mostly about issues of dignity and issues of orientation to the patient. Like, if you're like in a memory care unit and you have a lot of patients who have severe dementia or Alzheimer's disease, it seems like the logical thing that you should do is reorient them to reality when they're being hazy or when they're having their sundowners moments. And but is it really ethical to upset them? Like if they're saying, "Oh, my wife, I'm waiting for my wife." You don't want to look at the patient and go, "Your wife has been dead for 15 years." You don't want to say something like that. That's going to hurt them. So ethically, what you should do is, "Oh, well, she's not here right now. She'll be here tomorrow. She sent word ahead. She wants you to know she's going to come see." And like because they're going to generally forget that anyway, it's better to appease them than to. Do you see where I'm going with this?
Like, it's that thing of when you're a kid, your parents tell you never tell a lie. And yet, as an adult, you have to reckon with the fact that there are conscionably times when the lie is the correct decision. And it is better than the truth. Because what value is the truth when it causes hurt and distress to a person who is not in a position to resolve that? What benefit is it to someone to do that? And I do think there is an argument for that with gaining as well, even to the extent of, let's say it all turns out to be true, that gaining is the worst possible thing that you could do for your health, to become fat, to accrue all of this physical unwellness. Cool. What is the quality of my life then? If I have such a desire for gaining, and yet I say to myself, no, screw you, Uggo, you don't deserve to have this thing that you want, you should be thin, because it is better for you fitness-wise. What is that going to do for my sense of sexuality, for my mental health? I feel like we touch on this quite a bit. The reality is, for those people who finally take the plunge into gaining, there is just this release of the person that comes out where you go, oh my God, I have been withholding this joy from myself. And I think it's important that we come back to this because your mental health is just as important as your physical health. And sure, for some of us, we may encounter some amount of physical unwellness because of our size. But what's the trade-off when it comes to our mental health and our mental wellness? For some people, that might give them a foundation and a grounding that helps them to navigate the terrors of life. So really, for some, or for many, or for all, who knows? Is it worth it to sacrifice gaining for this proposed idea of physical wellness? We all know the story of someone's dad who was all into fitness and jogging, never touched sugar a day in his life, drops dead of a heart attack at 45. And why? Because his family had shit genetics and the dude had a heart attack. Was it worth it to agonize over the calories and the sugar content of your food just to die of a heart attack at 45? Is it perhaps worth it to say, fuck it, and have a good bloody time? The truth and answer, I think, lies somewhere in the middle. But I do
Well, never mind your body betraying you. You could walk out your door and any number of things could happen to you. You could get a car
go.
accident. You could get something could drop on top of you. I mean that I'm sorry. I know that random acts of violence, they don't happen so often that people are always on guard, but they happen often enough that people don't really think about that. They're like, I could I could get run over, I could get attacked, I could, like there's so many things that can happen to you that I'm not telling you to live your life in fear, but I'm saying like if you're setting yourself up for 80 or 90 years worth of misery, as opposed to maybe 60 to 70 years of joy and exuberance and enjoying life, I'd much rather take that.
Yeah.
I definitely agree with that as well. And I think that I kind of coming back to, and you mentioned how to like resolve that and how someone comes in with a health problem or they just have their routine bloods done and they have high cholesterol, for example. And, talking to them about, oh, you need to cut X, Y, and Z. You need to cut all of the nice things out of your diet to improve this number on a screen because studies would show that it's linked with like increased risk of heart disease, but is that actually resolving their reason for coming in? For some people, yeah, they might sleep better or have addressed that and address heart disease risk factors, but I think it doesn't always boil down to that number on the scale of like, okay, if this number was lower, that's going to resolve the issue that I or any person has come in with, and may not lead to like a longer, happier life either,
100%. Ultimately, I think more of us need to be cognizant that as much as we need to, I think it is good for us to be conscious of our health. I think it is good in practice for us to be aware and make decisions that, and like how do you personally balance that out? I love myself a well-cooked meal. I really do. I love it with all the calories, carbs, and flavors, absolutely. But I also love a salad. Like genuinely love a bit of lettuce. It's good bit of nosh. It's not gonna kill me to have salad every now and then, especially if I do like the flavor of it. Or it's a case of, do you struggle to get in your vitamins and minerals? Oh, I'm not a big fan of veg. Baby, drown it in a cheese sauce. No one said you couldn't. Like, sometimes you just got to make different decisions that, often we like say it's diametrically opposed. Like you can either have fat or health, as if you couldn't have both. But you can, to an extent, and just play with it. I think as gainers, we're transforming our bodies so intimately. Like, I would argue we should be very aware of our bodies. So when we're putting so much food in ourselves, we should probably feel more accurately than others, hey, I'm feeling a bit overly sugared today. I've been quite indulgent. Maybe I would feel better if I, had a little bit of something else to top off with. I don't think that's a huge thing. But also in saying that, like, if I get one more message from like a 120-pound twink being like, I'd start gaining, but I'm gonna get diabetes and die. Like, you are not, like, you are too, I'm sorry, baby, listening, you are too scrawny. You are too skinty. You don't need to worry about that shit right now. Oh, I'm worried about getting baby, worry about getting fat first. Worry about the poundage first. If you've got predispositions, fair dues. But if you are projecting these concerns about health as a justification to, hindering your own gaining pleasure, baby, that's some internalized fat phobia you've got to work through. We get this with a lot of different podcast episodes. People are very gracious, right? Of course, reaching out and saying, I want to start this, but, and every time I read the but, I'm always like, what is it this time? Like, what's a huge hurdle this time? Oh, ain't nobody ever come across this before. You about to break it all down for me, aren't you? You about to explain to me why you are the struggle and no one could ever help you. You must just be so challenged in your life. Nah, baby. Like, yes, but also breathe. Concerns, but also maybe not so much.
Yeah, I think there'll always be a million reasons as to why not to do something.
Mm.
And I won't say like if you're looking for them, but they can be quite obvious and stand out to you, like especially for gaming, I suppose. And yet you can cross that bridge when you come to it as well. And being tuned into like your own body or being open to that, because a thought occurred to me when I was getting ready for this. Is it that those who might be overweight or obese are maybe slower to engage with healthcare providers because there is going to be that weight bias or fat bias towards them, and that for that reason their concerns are not addressed and they're pushed further down the line. And I can say that from my own experience, how I put off dealing with, in this case, like being assessed for sleep apnea, because ultimately I knew that weight was going to come up, and how was I going to navigate that conversation? So yeah, there's always reasons as to why not, and to put off maybe dealing with a health issue or anything in life really, but especially like I suppose gaining as well, and take the time to kind of assess it and see if it's really for you, or even just go for it.
Something I think, since we're having a medical discussion, we can't forget that there are some people in the community that actually get off on the taboo nature of this, of the fact that it is considered unhealthy, of the fact that it's considered the forbidden fruit to get fat. And so I have known gainers to get sexually excited by the idea of trashing their body, as they put it. So that still exists within the community too. People who purposely want to reach a level of unhealthiness because it feeds into their self-image of being the slob, the glutton, the greedy. I can't think of another euphemism here, but you know what I'm talking about, right?
We talk about this a lot. Ultimately, we don't judge that approach to gaining on this pod because obviously every approach to gaining is valid. It's your life. You do what is right for you to do. I think I really want to zero in on what you were saying, Andy. Like, you can always find reasons why not to. It's that thing you said, Andy, about you can always find a reason not to. And I think that's very, very true. But of course, there's always a reason not to. There's always a reason to, as well. So you just kind of come back to this never-ending stalemate. Again, it's that thing of people want to reach out and be like, how do I start gaining? How do I come to this decision? No one's going to hold your hand. No one's going to do it for you. You have to answer that question for yourself. You have to make those decisions and decide what you feel most comfortable with, and decide this is how I'm going to navigate that. But if I can put it back out there, for me, advocating for my health felt wonderful. It felt wonderful to be in charge of that conversation, to say, this is what I'm dealing with. This is what I need. This is what's been suggested to me by a friend. You are the doctor. I come to you with my symptoms. I come to you with recommendations that other people have said have worked for them. You let me know what you think. And then they go, okay.
Do you think that there's like a term of death feederism and taking all of those health complications on board as well, or celebrating them and inviting them and that? And yeah, I think, I suppose from both like a gainer and like a medical perspective, it is to each their own. And you're there to treat your patients in a non-judgmental manner as well. And so for that reason, I suppose if debt feederism is something that you want to do, okay, go for it. If on the other hand, you kind of lean into that because you don't want the hassle of engaging with doctors and advocating for yourself, which is a hard thing to do, I suppose that we as a community in general need to kind of work on empowering each other to advocate for ourselves, and if we so wish, deal with health issues as they arise and deal with them in a way that still aligns with gaining goals, or if that changes as well, also like support gainers who may want to lose weight for the benefit of their health.
I think that's important. We've talked about that as well in the past. People lose weight for different reasons. And there is a trend in the community I've noticed where if someone decides that they want to lose weight, it becomes like the worst kept secret in the world. And it becomes a mark of shame that some people go on about, oh, so-and-so's decided to lose weight. I can't believe they would ever have even bothered having a Patreon or an OnlyFans. They've just been taking money out of the community to fund themselves, and now they're going to quit. How dare they? Huck, spit on their grave. Like, ridiculous.
Yeah, it drives me nuts because there's a very clear difference between someone like, I'll drop his name again, Bruno Barra, who did it just to get attention, just to get money. And that's literally all he got out of anybody was money. Because I subscribed to his Patreon for 1 month to see what it was all about. And he wasn't putting anything on there that he didn't put out for free on X. So there's a clear distinction between that and someone who has been in the community, has been established, has grown a bit of a following, and then says, you know what, right now this just isn't working. I need to reframe. I need to do something with my life to alter it in some kind of way. I think I need to lose the weight right now. There's always the option to come back to it. And how many times have we seen gainers who are like, you know what, I'm gonna lose weight for a little while. I'm gonna, slim down, bulk up maybe. And then a couple of years later, they're like, I'm back on the gain train again. The fact that you need to lose weight or want to lose weight for whatever reasons you have, it doesn't negate being a gainer. You will always be a gainer. If I was 125 pounds, I'd still be a gainer.
I could see myself going down a whole different rabbit hole on the kind of parasocial relationships that develop online with people that we might think that we know through following them. And I'll admit it, I feel those kind of feelings crop up where you're disappointed a kind of gainer that you're following has decided, oh, they're going to lose weight. But also keep those in check and just kind of tamp it down a bit and just like, no, there's a human person on the other end of that screen and they're making that decision and doing what's right for them.
So I'm a little curious here, because obviously there's that, weight loss fads. They've always kind of been a bit of a thing, right? But as far as it comes to, like what you observe from your end as a doctor, like what do you make of moments like that when it comes to this idea of looking after our health, but submitting ourselves to cultural trends, which may or may not even work?
Yeah, I think it might even call back to that idea of, going to the doctor and being told this is what's wrong and you take this thing and it will fix it. And then people hear about this option to do that. And it's not without its risks either. There can be complications from different treatments. And there's a lot of different options. They're not as accessible. People put in a lot of money into them to get some kind of perceived benefit, I suppose. Whether that actually comes through or not is a different thing. And yeah, I suppose they can be harmful. They can be really helpful for different people, whether it's just purely to lose weight and fit into their old clothes, or like reversing like pre-diabetes or something like that. To kind of link it to what we were saying earlier is that it's not without its risks, and it's not something to enter into lightly as well, and maybe to consider it, weighing up the pros and cons of it before engaging in it.
I mean, as a way to close out this conversation, what do you want listeners to take away from today's discussion?
I think it's always going to be very individual, people's experiences with gaining and their health. And gaining is a big part of someone's life for every gainer. And there's definite associations with health as well. I think it is listen to your body as well and to pay attention to it, and don't Google search too much. I think try and find a good doctor that you can discuss things that you have searched if you're experiencing problems, and have that open conversation. If you have the opportunity to find someone else who can support you in meeting your own needs and listening to your body, identify your own needs, get that support that you need, and get them from reliable sources, and speak to a doctor or medical professional about it.
I really like that. Look, I think this has been a really interesting conversation, and I always value and appreciate when we have medical professionals like yourself giving your time and your energy and your expertise to what we do here at Thicc Radio. So, Andy, I just want to say a big thank you for your time today. This has been a real pleasure.
Thank you. It's been great. It's been a good time, really enjoyable experience. So thank you for having me.
Well, you're welcome. Now, where can our listeners find you online?
Yeah. So you can find me on Grommr. It's at dandybuns.
Love it. Well, that's it for another week here on Thicc Radio. Please remember to like and subscribe, rate us 5 stars, and leave us a good review. Now, if you liked this episode, the podcast, or just us in general, please share it with your friends and encourage them to tune in. You can find me on Instagram and BlueSky at stannnum.
And you can find me on Instagram, Twitter, YouTube, and TikTok at ThickyMouse. You can also look us up on Instagram, YouTube, and TikTok at Thicc Radio, or at our website at podpage.com/thiccradio. If you want to submit a voice note or become a financial supporter of the show, you can find the links in the show notes, and you can always write to us at thethickradio@gmail.com. So until next time, bye, Fats.
Bye, Fats.
Bye, Fats.
Let's talk about it.
Thicc Radio is a Patreon and Enter app podcast produced by stannnum and Mouse.
Mixed and mastered by stannnum.
Our artwork is provided by Lokitu.
Our theme song is provided by Spotify.